President Biden recommended that Americans get a third COVID-19 booster shot, but not so fast. Many medical professionals don't think that most Americans should get one. So we asked infectious disease specialist Dr. Shobha Swaminathan from Rutgers, New Jersey Medical School for her recommendation. Doctor, as always, thanks so much for your time today. We've got some important questions about booster shots. Who should be getting them?
So the CDC recommendation is that persons over the age of 65, adults who live in congregate settings, nursing homes, other long-term care facilities, and persons 50 to 64 with underlying health conditions are the people who should get the booster shot. Now, there are other individuals like persons 18 to 64 who may be in occupations that put them at increased risk for exposure, frontline workers, healthcare workers, teachers, etc. They could consider getting a booster shot depending on how they feel their risk might be from getting complications from COVID-19.
But they just approved the booster shots for everybody, right?
So the CDC guidance actually says the booster shots, it's okay to get the booster shot if you need those things. And the rationale is when you look at why someone gets a booster shot, right? If you step back and think about it, it's because once you get the primary series of vaccination, 2 shots for the messenger RNA and 1 for the J&J, over time, your antibody levels have been shown to drop a little bit. That being said, the ones that have gotten serious infections over time are really in the group persons aged greater than 65 or people with those underlying health conditions. Those are the ones who've gotten slightly more ill because of COVID-19 despite getting vaccinations. While young, healthy adults may have had what's called breakthrough infections, but the majority, people who have had those, unless they have underlying health conditions, have tended to have milder infections, haven't required hospitalizations, and for the most part haven't died. So the priority is really making sure that you don't get seriously ill from COVID-19.
I get it. Let's just say, though, you're 45 years old, you're perfectly healthy, you go to the gym every day, you just want that extra protection. Is there any harm in getting a booster shot?
No, there is. The data clearly shows that the booster shots, the side effects would be no worse than what you would have received from the second shot. So essentially, the only group for whom a booster shot should be given is if you got the J&J vaccine and it's been at least 2 months, because the decline in titers happens much more faster. Any adult who got the J&J vaccine, if it's been at least 2 months, they should get it regardless of their underlying health condition, if present or not.
But if you got the J&J vaccine, you should now go get the Pfizer booster shot, right? You shouldn't. You could. You could.
The recommendation actually is if you got the J&J, you probably should get a booster from one of the messenger RNA vaccines, either the Pfizer or the Moderna.
So there's no problem with that at all. I want to change topics for a second, because one of the reasons people might want to get the booster shots is because of this fear of where this virus is going, what it's mutating into. We all know about the Delta virus, and now we hear about the MU virus. Is there anything new, and do you have concerns about where this is going?
I think the priority is always to get as many people vaccinated as possible, because as long as you have susceptible hosts, there is an environment for the virus to keep multiplying. And if every time a virus multiplies, it changes a little bit. That's what happens. When the virus multiplies, it has small changes in its gene, and that's what's called mutations. Once a virus accumulates enough mutations for it to change, oh, you know what, I'm changed enough that maybe I can infect more people, or I can cause more severe disease. That's when it starts label it like a variant or a variant of concern, when it's large enough to impact those groups, like cause more infections, spread more easily, and cause more severe complications. If we don't get enough people vaccinated in time, you're going to have a lot of people who are susceptible to this. And therefore, over time, the virus can figure out a way to overcome the immunity, potentially. Thus far, the reassuring thing is that even with the Delta variant, et cetera, while there have been some breakthrough infections, the protection conveyed by the vaccines have been reasonably good, particularly with respect to severe disease. Except in a select group of people, like persons over the age of 65 or if you have underlying health condition, maybe you need the additional booster to boost you up just enough. But it's all a matter of time. We have to make sure we stay ahead of the virus and not constantly play catch up. It took us a year to, and we're still playing a little bit of catch up, but by getting enough people immunized and by getting enough people or sick immunosuppressed people, getting them the booster shot, we want to kind of cut the cycle of spread of infection from person to person. And the last point is unvaccinated people do tend to have more virus present in their system and therefore generally transmitted more readily and to more people than those who are vaccinated.
If you have more virus in your system, like you just said, the unvaccinated, you hear so much about these antibodies. Are antibodies built up even when you just have the virus and you're asymptomatic?
Yeah, so asymptomatic infections typically occur in people who are vaccinated. So they have enough antibodies that protect them from severe disease, but maybe it doesn't protect them from having like a mild case or a minimal case where you just have the virus. But even that will help you develop infection. But now that's people who are vaccinated. If, on the other hand, you were never vaccinated and just had a very mild case of COVID, there is enough evidence to tell us that those people actually don't have as good an immune response or as high an antibody response as those who had more severe COVID and recover. So actually, if you had a very mild infection, the odds are you don't have enough antibodies to protect you from a second infection.
You just, in answering those questions, you gave a lot of reasons for people to get vaccinated. I'm sure you've dealt with people that are vaccine hesitant. What do you tell them? Is there a way to convince somebody to get vaccinated when you are a physician?
I think we can. The vaccine efficacy information has been out at this point for more than 10 months because December of last year, with the efficacy results for the first Pfizer and Moderna data were released. So there's enough medical information and we have enough long-term data to safely state that the vaccines work and they are safe. But it's really become a divide between what the mind knows and what the heart believes in, because it's sort of like a core belief. Like, I know this information, but that's not what I choose to believe. All I can say is, as a physician, I've seen the vaccines work and keep us all safe. As a human being, I've had firsthand experience with my parents. My parents are older; they're in their 70s. They do have underlying health conditions, and they had to go to India for personal reasons. And I would not let them travel until they were fully vaccinated. They went to India and they lived through the worst of the pandemic in India, when there was shutdown and people were really dying. I remember my parents telling me that all night long, all day, all night, they kept hearing the ambulance sounds of people driving, trying to find hospital beds. My father did get COVID about 2 months after he was fully vaccinated. Despite that, he was sick for a day and he survived. He did fine, thankfully. My mother, who lived in the same household, who was vaccinated, never got sick. And actually, I think it also protected my grandmother, who wasn't able to get vaccinated. Then she never even acquired COVID. So, all I can say is I'm really thankful that in some ways the work that I was a part of doing helped protect my parents. And especially because I know firsthand of many family members that I've lost in India because they were unable to get vaccinated. We are privileged to be able to have access to vaccines, and we should use that.
Well, that's an important story, and I'm so glad your parents are doing fine. I'm so glad they got vaccinated. Thank you so much for your time.
Thank you.
Dr. Shobha Swaminathan, Rutgers, New Jersey Medical School. Next on Jersey Matters.
COVID-19 vaccine mandates across the country are forcing people to either get their shots or possibly lose their jobs. We'll speak about just that with some New Jersey first responders. Coming up next on Jersey Matters.